And now to a special feature this evening. The Global Burden of Diseases study estimates that 5 million of deaths recorded annually are caused by a particulate matter, an air pollutant popularly known as a PM2.5. These particles are released in the atmosphere by various sources such as dust, forest fires and volcanoes, as well as through human activities such as fuel burning. And as Opicho Chemtai found out during a visit at Kamulu area in Nairobi County, the death of a man due to alleged accumulation of these pollutants in his system point to a lethal risk lurking in the atmosphere.
Some 50 kilometers northeast of Nairobi lies Kamulu, one of the country's fast-growing suburbs. From a distance, all seems okay until you veer off the main road and take a turn towards Kamulu's Polytechnic Road. Here, visibility is hampered by dust storms due to the poor state of the road, worsened by numerous trucks ferrying construction materials crisscrossing the area. The amount of dust here makes the use of face masks a necessity in breathing. A few meters off the road, one of the residents who requested anonymity for fear of victimization ushers us to her homestead. As we go through her gate, it's dust particles everywhere that you can hardly notice the beauty of the home. This situation has chased away potential tenants. But even more painful is the death of her husband a few months ago, with a medical report citing dust particles as a major cause.
Maana wakati tulienda hospitali aliambiwa kifua imejifunga, na it was true kwa sababu kifua yenyewe ndio ilileta shida. Akaanza kusikia anashindwa na kufumua, na alikuwa amepata chanjo ya C19. Kwa hivyo hatuwezi kusema ni C19.
Whereas moving out is not an option for her, getting a solution for this problem has not been easy either.
Na tukiongea na hawa watu wa maroli wanatusi sisi. Hata watu wa pikipiki unaona vile wanapita, hawataki kuona nyinyi, wanaogopa. Ingawa tukisaidika, si hata pia hawa wanasaidika.
Na huko kwa neema walituambia ati kuna wakati tutakuwa tukikufa mmoja na ugonjwa itakuwa moja.
Her neighbor, Catherine Njuguna, attributes her respiratory ailments to the air pollution the dusty road has subjected them to over the years.
Hata ugonjwa haisangi. Macho ndio hiyo. Mimi nasidaga kwa macho, hata kuona sionangi bali. Unaona? Nasidaga huko Kikuyu kwa macho. Ni pesa tu kutoa, hakuna mtu ananisaidia.
Kwetu ukiingia ni kama ma chemist. Homa haishi. Sasa tunasidaga tuna madawa. Mtoto kukohoa, sasa unashindwa utamshidisha tu kwa madawa. Kesho yake anaanza huko tonsils, amefugana.
Paka unatamani tu kuhama. Sisi tunatafuta hata mtu wa kuuzia nyumba tuhame tutoke huku juu. Sasa unaishi huku, saa yote uko na madawa. Unajua zi mzuri sana unakaa na hata tuko Nairobi. Surely. Hii ni Nairobi gani? Na dust imejaa. Nilikuja huku sikuwa na shida ya kifua, sikuwa na shida ya macho, sikuwa na shida ya araje. Sasa hivi na shidaga hospitali na madawa.
Gideon, an air quality expert from Airco, whom we met at Mama Lucy Hospital, says air pollution is a major concern.
One of the reasons why these monitors were thought of to be brought to the city is the health of Nairobians is deteriorating. So air quality keeps getting bad, and we don't know how much, we didn't know before how bad it was.
Air quality monitors installed by the county government reveal high levels of the particulate matter air pollutant in some areas.
We have to measure PM2.5 so that we can know before people report to hospital with illnesses that a certain area has an issue, an air quality issue, so that when doctors want to respond to their problems, they understand that these problems are coming from the environment rather than from other things that they would have already thought of.
But how harmful is particulate matter if exposed to over a period of time?
Taken in through your nostrils, these tiny particles can make their way to your respiratory system, including your lungs, and also cause health problems. For instance, the increasing cases of asthma and other illnesses that you can attest in the citizens of Nairobi can be linked directly to what the quality of air they are taking in. And for those whose monitors, for instance, if you are living close to Kamulu or in Kamulu and your monitor is always between the colors red and brown, you are living in an unhealthy place if it continuously reports the same colors throughout the time, and you should be worried that any respiratory related problems might be coming from the quality of air you're breathing within the area you're living in.
These are the kind of air quality monitors that would be sent to Polytechnic Road that will facilitate the collection of real-time data on PM2.5 for the necessary authority to act on it. As for now, the feasible solution to this pollution will be to jumpstart the tarmacking of this road.
Tumegojea for very long. Tumeenda mpaka kwa neema. Hatukusaidika vizuri because tulikuwa tunafikiri tukienda kwa neema watatusaidia. Wakati tulienda kwa neema tuliambiwa hii barabara sijui ile pesa ilikuwa itengenezwe, sijui ile pelekwa barabara nyingine. Sasa hatuelewi hapo ni nini kiliendelea. Lakini kwa nini wasitutengenezee? A task that lies squarely within the Kenya Urban Roads Authority.
We are hoping to get money so that we can actually extend and put some measures that can enable us ensure that they don't overload, because if they overload again, they destroy the road. At the moment, we have not received any funding for the additional for phase 2, but we are still pursuing to see whether we can get resources.
Kamulu residents can only hope that this promise will not turn into another when funds become a viable tale. Slow, but it ultimately kills. Urgent mitigation measures need to be put in place to avert such disastrous occurrence. Just like this family, they had to part away with a loved one as a result of inhalation of a lot of particulate matter. Opicho Chemtai reporting for Channel 1 News from Kamulu, Nairobi County.